Today we talk about how to navigate the often confusing world of over-the-counter medications during pregnancy, what's safe, what's not, and how to make the best choices for you and your baby's health. I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday. I remember when my wife and I got pregnant, and we were so excited to be pregnant that one of the things we were most scared of was screwing something up. And that meant anything we did, whether it was having intercourse or what we ate or flying a plane, we were always afraid of could we cause harm. Well, in this episode of this podcast, we're going to step a little away from fertility, but talk about what's safe to take in pregnancy. And then in the following episode, we're going to talk about what things are okay to do when we sometimes are worried about them, such as having intercourse and is it dangerous? And the reason for this episode is because when it takes time to get pregnant, when you have feared that you may never be pregnant, you are terrified of doing something wrong. And so this episode is for everyone who has been in that moment and want to have a resource to fall back on to know what to do. In this podcast, we're going to break each topic up into several categories. And so if you just want to hear about that category, you can usually forward to that by hitting one of the chapters. So the first part we're going to talk about is nausea. The second will be fever and pain. The third will be about GI upset in pregnancy. The fourth will be gas that you get during pregnancy. The fifth will be talking about allergies and medications for that. And the last one we're going to talk about is cough and cold medications. I'm not going to talk about supplements such as herbs, and that's because they are not FDA regulated. And so although supplements and herbs are okay, especially when you're talking about herbal medications, I'm going to keep this to medications and over-the-counter medications that are from the FDA. Additionally, I'm not going to go over medications that you would take because these are things that you would get from your doctor, but medications you can get over the counter. Nausea. Nausea is one of those things that everybody likes to have because it tells them that the pregnancy is going well, but they also don't like having it because you're nauseous. And nausea is one of the things that people hate even more than pain. And so for most women, they're going to have a little bit of nausea. And you might feel like you're going to vomit. You might even have dry heaving. And so in the past, years ago, there used to be a medication called doxylamine. And that was taken off the market due to risk of lawsuits. And so what happened is over the years, doctors have been giving patients vitamin B6 and Unisom to be able to recreate that doxylamine and to help with that nausea. This is a very effective medication and was even put into another brand at one point, but they took it off the market again. To create this pill, you just need to take 25 milligrams 3 times a day of vitamin B6, also known as peroxidine, and Unisom, also known as doxylamine, 12.5 milligrams, which is half a tab at night. There are other things you can do, such as ginger snaps, pressure bands, and even more aggressive treatments such as medications, such as Zofran. However, if you're having some mild nausea and you want to recreate the medication Bendectin, later named Diclegis in the past, all you need to do is take some vitamin B6 and half a tab of Unisom. The next part that we're going to talk about is fever and pain in pregnancy. One of the safest drugs to use in pregnancy for fever or pain is using Tylenol. It will help with pain. It's going to help with fevers. Now, there are other medications such as ibuprofen and naproxen. And those medications should be used very cautiously. What I usually tell people is don't take them unless a physician tells you to take them. But the question is why? There are several reasons why you shouldn't. One of them being that, especially in the later term of pregnancy, like in the third trimester, it can actually cause premature closure of the ductus arteriosus, which is an important blood vessel. And if that blood vessel is prematurely closed, it can lead to pulmonary hypertension in the fetus. Now, naturally, this closes at birth, but it shouldn't be closed before then. The other thing is it can also reduce amniotic fluid. Low amniotic fluid can be associated with fetal growth problems, lung issues, and sometimes even the limbs can become contracted because it has less room. The reason for this is that the kidneys on the fetus won't make as much urine because of the ibuprofen. There's also slightly increased risk of bleeding when you're taking ibuprofen. So when it comes to fever or pain, stick to Tylenol, and if you need more, make sure you go to a urgent care, ER, or talk to a physician before taking other medications. The third section of this podcast is going to be talking about GI upset. So for heartburn, using things like Tums, Pepcid, or Mylanta are safe options. If you're having constipation, you can always use Colace, and if you're having issues with diarrhea, it's safe to use Imodium. Now, like anything, everything should be in moderation. You shouldn't be treating yourself. So if you have constipation that's not getting better, you need to see a doctor. The same thing if you're having diarrhea that's not responding to Imodium, don't keep taking multiple doses of Imodium, go and see a doctor. Now, on the other hand, things that are not safe for GI things are going to be things like Pepto-Bismol. This is because Pepto-Bismol has salicylate in it, and that can cause issues in the first trimester and in the third trimester. Now, this doesn't mean you can't take a medication that I talk about if your doctor says you can take it. This is just talking about medications you can take and feel safe taking over the counter when you have some symptoms. And for those of you who are a little bit older, another option for indigestion is MOM, also known as milk of magnesia. Next, we're going to talk about having gas, also known as flatulence. Through pregnancy, it's normal. Women are going to get gassy, but sometimes you become extra gassy. It can be quite uncomfortable, especially with the fact that there now is a baby in your abdomen and you have less space, and that means that baby can be kicking your bowels and can be causing problems. The best medication to use for gas is going to be products like Gas-X, also known as simethicone. These are over the counter and can be taken safely. As with prior recommendations, if it's not getting better with the medication or is it becoming unbearable, definitely see your doctor and they can give you other medications that work similar or even stronger than the over-the-counter varieties of it. Next, we're going to talk about allergies. Everyone gets allergies and they have sniffling noses, they have coughs, they have a little bit of post-nasal drip. We're not talking about being ill. So this is not talking about flus and colds. We're just talking about your typical daily allergies. Most antihistamines are going to be safe. This includes things like Benadryl, Claritin, Zyrtec, and Aleve. Unfortunately, Benadryl makes you pretty tired, and so most people are going to use things like a Claritin or Zyrtec to reduce being tired. There are other medications that your doctor can give you if allergies are becoming too severe. But when it comes to over-the-counter, you're perfectly fine taking things like Zyrtec and Claritin. Now, you don't want to take what's called like Claritin D or Zyrtec D, which stands for decongestion. That's something we're going to get into next. And that actually should not be taken. So things like phenylephrine and pseudoephedrine are two decongestants out there. These are commonly mixed with the antihistamines to create a less sinus pressure and will also then help with your allergies. But unfortunately, you do not want to be taking Sudafed or pseudoephedrine or phenylephrine while pregnant. It doesn't mean you can't take it, and it's okay when you're doing it under a physician's supervision, but there are many cases where you do not want to take it, and that's why it's important to talk to your doctor. What I would recommend is don't take any decongestant like Sudafed, which is the brand name, but pseudoephedrine or phenylephrine when pregnant without doctor supervision. The last thing we're going to talk about is like cold and flu medications. And although there are many other categories that need medications, the reason why we're talking about these is because these are the main categories that come up. But if you have other questions about other medications and want me to do another episode on this, I can. So when it comes to cold and cough medications, there are some that are very safe. Tylenol is a safe medication. So you're having a little bit of headache or a little bit of fever, take some Tylenol. Dextromethorphan is a cough suppressant that you can usually get, and it's considered safe in pregnancy. The same thing with guaifenesin, which is an expectorant. So if you feel like you need to cough stuff up, if something is kind of stuck, you can take that to help pull things up. Another medication that can be used is Robitussin, especially Robitussin DM, which contains both the cough suppressant and the expectorant in the formula. But this is where it gets tricky when it comes to cold and flu medications. A lot of them combine a bunch of medications together, and you're going to have to read the labels. In general, it's best to just take the individual medications and create it yourself. So for example, there's meds like Dayquil and NyQuil. Sometimes these medications do have things like pseudoephedrine and phenylephrine in them, which shouldn't be used in the first trimester unless under the guidance of a physician. And so I don't recommend taking these medications that are a conglomerate of other medications, but instead taking the individual medications. That way you know you're not taking something you shouldn't. Now again, that being said, if your doctor says it's fine for you to take it, then that means your situation is safe and you can take the Dayquil or NyQuil. But again, make sure you talk to your physician because in general, we do not recommend that. What is important to understand about with this podcast is we're going over medications that you can take and not be worried about. But for some of these medications, such as taking Sudafed, such as cold medication, flu medications that have Sudafed in it, you'll need your doctor's guidance because potentially you may have a situation in your first trimester that they don't want you to take that and it could cause some harm. In general, stick to the medications that we discussed that were safe. And anything outside of that, please talk to your doctor. Hopefully this episode was helpful to you, and maybe you know someone who's pregnant it might be helpful to. I remember when we went through, it was definitely something we didn't have a list of safe over-the-counter medications, and we kind of felt lost. And so hopefully this will help you if you're pregnant now, maybe you're going to get pregnant, or when you do get pregnant, you now have this resource to go back to make sure you can reference when you're dealing with some mild illnesses or issues during pregnancy. I do want to make sure that you understand this list is not exhaustive. There are other medications. I was just going over the more common ones to give you a general idea. In a future episode, we'll go over things like activities that are safe to do in pregnancy, such as intercourse and swimming and flying planes. As always, I greatly appreciate everyone listening to the podcast. And as I always say, if you know someone who's going through this that might help, tell them about this podcast episode and give them that resource. Like I said, if you don't want to listen to the whole thing, just jump to the chapter that helps you. As always, if you love us, give us a 5-star review, tell us to your friends, and most of all, keep coming back. I look forward to talking to everyone again next week on Talk About Fertility Tuesday.